Today I will be presenting about the introduction to emergency procedures in wilderness and everyday situations. Starting off with common wounds and first aid treatment. So some common wounds are cuts and scrapes, shallow or deep ones that break the skin, bruises, discolored skin caused by trauma to the blood vessels. First aid treatment for cuts would be clean the wound with clean water and apply pressure to the area to stop the bleeding, and then cover that with a sterile bandage or dressing. For bruises, first aid treatment would be applying ice to reduce the swelling and elevating the injured area if possible. Wilderness consideration would be to use clean cloths or gauze, bandages, or whatever you have available, and clean it out with either water or use antiseptic wipes just to sterilize the wound. And if you don't have access to that, you can boil water and then use it. And then moving on, we have types of shock. So first we have hypovolemic shock, which is caused by severe blood loss. We then have cardiogenic shock, which is caused by the heart's inability to pump blood. We then have anaphylactic shock, which is a severe allergic reaction. And then finally, we have septic shock, which is due to infection leading to systemic response. Treatments for this could be for hypovolemic, it could just be to control bleeding, elevate your legs, cover the person to prevent shock. Cardiogenic would be keep the person still and provide oxygen if available. For anaphylactic shock, keep the person lying down and seek medical help. And then for septic, seek medical help as well, and then immediately maintain the body temperature. For wilderness consideration, apply pressure to control any bleeding. Use any available supplies to elevate the legs. Try to keep the person calm and warm them up until help can arrive. Now we have types of poisoning in treatment. So types of poisoning, so ways you could be poisoned would be inhaling something, which is breathing in any toxic fumes like carbon monoxide or smoke. Ingested poisoning would be by swallowing a harmful substance. Contact poisoning would be touching something with any chemicals, anything like that, which would be entering through your skin. Treatment would be, for inhaled, would be get fresh air immediately. Ingested, call poison control and avoid any vomiting unless instructed. Contact would be to rinse with water for at least 15 minutes. And then for wilderness consideration, if the poisoning is caused by a plant or animal, you could use natural remedies, and then you could also seek help as soon as possible. Now we have classifications of burns and treatment. So the classifications for burns are first degree, which is just redness and pain. Second degree would be blisters, swelling, and then pain again. Third degree would be white or charred skin, and there would be no pain due to nerve damage. So the treatment for first and second would be cool off the burn with cold running water, cover with a nonstick bandage. And third degree would be do not remove clothing, cover with the clean cloth, and then seek medical attention immediately after. And for wilderness consideration, use cold, clean water to rinse the burns. For more severe burns, keep the victim warm and that's just to avoid any infection by covering burns with, and then cover burns with sterile cloths like before. Now we have effects of heat and cold first aid. So heat illnesses could be heat exhaustion, which comes along with heavy sweating, weakness, things like that, dizziness. A heat stroke is high body temperature and then confusion. Then we have cold illness, which could be hypothermia, which means the body temperature is dropping below manual. We have frostbite, which is freezing of the body tissues, and that's most common in your fingers and your toes. And treatment for that would be heat. Now we have immobilization for suspected fractures. So signs of a suspected fracture would be pain, swelling, deformity, inability to move that limb, things like that. And then the types of fractures could be closed bone, which is when the bone does not break through the skin, and then there's open when the bone does pierce through the skin. Treatment for that could be immobilization, so that could be you're being put in a cast, a splint, things like that, crutches, just to stabilize the area. Things that you shouldn't do is don't move the person if you suspect any spine injury. Something that would help would be elevate the area just to reduce the swelling. And then for wilderness consideration, if there's no medical equipment available like a splint or anything, use sticks, branches, or materials to prevent movement from that certain limb. Keep the injured person as still as possible as well. First aid for foreign objects in the eye or in the ear. So signs of this could be pain, redness, tearing, blurred vision for your eyes. Treatment is do not rub your eyes, rinse with clean water or saline solution. If the object is stuck, cover your eye with a clean cloth or an eye patch or anything you have available, and then seek professional help. For a foreign object in the ear, signs could be pain, difficulty hearing, or the sensation of something in your ear. And treatment for that would be do not use cotton swabs or any objects to remove the object. Tilt your head and let the gravity help or flush with clean water. And then for wilderness consideration, if water or any saline isn't available, you could just use clean cloths to cover the eye or the ear to protect it until you can get access to help. Now we have basic life support, or otherly known as BLS. So basic life support steps are to check for responsiveness. So tap or shout. If no response, then proceed. Step 2 is call for help. Step 3, check for breathing. So you can either look, listen, or feel. If no breathing or irregular breathing, start CPR immediately. So step 4 is then CPR. Which is just chest compressions at a rate of 100 to 120 compressions per minute. So 30 compressions followed by 2 rescue breaths. And then for wilderness consideration, if you're alone, perform CPR for 2 minutes before seeking help, just to ensure you have a clean path for or help signal for assistance in like a remote area. Now we have CPR demonstration. So step 1 is position. Place the person on their back as on a firm surface. And then step 2 is use 2 hands to start the chest compressions, interlocking your fingers and pressing down hard and fast in the center of their chest. Step 3 is rescue breaths. So after every 30 compressions, give 2 rescue breaths just to ensure that the airway pipe is open by tilting the head back, so make sure you do that. And then for wilderness consideration, so if you're in a remote area, focus on chest compressions. If you're unable to provide rescue breaths, especially if help is far away. Now we have first aid for choking. So choking in adults, signs could be inability to speak, cough, or breathe. You could also see a panicked expression. Treatment for this would to perform the Heimlich maneuver, which is basically abdominal thrusts. This is when you stand behind the person and wrap your arms around their waist, and you make a fist just above the navel and perform inward and upward thrusting motions. Choking in children or infants, place the baby down on your forearm and give 5 back blows or 5 back taps. Wilderness consideration, if alone, perform the Heimlich maneuver on yourself by using a solid object like the back of a chair or table to create pressure. Priority of care in an emergency. So number 1 is airway. Ensure that the airway is clear. Number 2 is breathing. Check if the person's breathing. 3 is circulation, so you want to check for a pulse. Disability, check if there are signs of neurological impairment, such as unconsciousness, confusion, things like that. Step 5 is exposure, access for any life-threatening injuries or conditions. Wilderness consideration: in an emergency with multiple people, prioritize the most life-threatening conditions, which would be the airways, obstruction, bleeding. You might have to improvise the treatments if you're in an area that you can't seek help immediately. Activation of the emergency medical system. So how to activate this, otherly known as EMS. Step 1, call emergency services. Describe the situation. Step 2, give the location, number of people affected, and the type of emergency. And then for wilderness consideration, in areas with no cell phone signals, use a whistle, flare, or signal fire to alert rescuers if possible. And if you don't have access to those things, you could walk to the nearest location with service. And finally, the conclusion and final thoughts. So the recap: we covered a range of emergency procedures for common injuries to life-saving techniques. Some final tips is to stay calm and assess the situation. Always have a first aid kit and know your surroundings, especially if you are in the wilderness. Prioritize life-threatening issues and seek help as quickly as you can. And next steps would be practicing CPR, first aid, and other skills just to be ready for real life emergencies. Thank you.